Thank you for listening to Depictions Media Radio. Okay, welcome back, everyone. Next, we're listening to Justin Trudeau and Dr. Tam and Dr. New, and as well as Dominic LeBlanc, the Intergovernmental Affairs Minister, talk about what is going on the Parliament Hill. We're going to hear about vaccines. We're going to hear about updates on COVID-19 from Dr. Tam and Dr. New. And we're also going to hear about the emanating shutdown of Enbridge Line 5 pipeline. And we're also going to hear about transit funding for Greater Toronto Area, the rapid transit project for Hamilton, where they are being promised a federal investment of $12 billion. Now, of course, when British Columbia went to get funding for transit, they were denied part of that funding for BC ferries because the federal government didn't quite understand how a ferry system was part of a city transit. And it actually turns out that BC Ferries is an integral part of the transit system for British Columbia, moving people backwards and forth from islands so that they can either perform jobs, do business, those sort of things. And if we listen closely to what is going on with this particular project for Greater Toronto Hamilton, maybe there will be lessons to be learned in how to get that funding needed for transit in other areas. So let's listen to that very closely as we listen to what evolves in the whole press conference coming up right now.
Hello everyone. Bonjour tout le monde. Je suis heureux d'être ici aujourd'hui avec le ministre Leblanc ainsi que la Dr. Tam et le Dr. New. Aujourd'hui, je vais parler de notre lutte contre la COVID-19 et des mesures qu'on prend pour créer des emplois et rebâtir un Canada plus propre. Cette semaine, c'est la semaine de la profession infirmière. C'est l'occasion de souligner l'importance et l'expertise des infirmières et des infirmiers au sein de nos systèmes de santé. Bien sûr, c'est aussi l'occasion de les remercier à nouveau pour leur travail. C'est grâce aux efforts et au dévouement des infirmières partout au pays qu'on a pu traverser cette année difficile. Yesterday, I met virtually with nurses in Manitoba to say thank you for their incredible work and to hear how things are going on the ground. I got to hear firsthand how exhausted they are, but also how determined they are to continue to be there for Canadians. So to nurses across the country, I know this past year has been tough and that this third wave is even harder. But you keep stepping up for your patients and for Canadians. Thank you for your dedication, your skill, and your compassion. Our government will continue to be there for everything you need, from vaccines to rapid tests to PPE to everything else. Our fight against COVID-19 is not over. In many parts of the country, cases are still too high and hospitals are still under incredible pressure. But there is hope. More Canadians are getting vaccinated every day. Almost 50% of eligible adults have received at least one shot. Canada is in the top 3 countries in the G20 in terms of daily vaccinations. By summer, we'll have enough vaccines so that every eligible Canadian will have gotten their first dose. And by September, as we've been saying for months, we'll have enough doses for every Canadian to be fully vaccinated. So here's the situation. More and more Canadians are getting vaccinated. But like we know, cases in far too many places are far too high. We can't ease public health restrictions until cases are way down. We all want to have a summer where we can see our loved ones and invite friends over for barbecues. We can have that summer. We can have a one-dose summer. But for that, two things need to happen. First, restrictions need to remain in place until cases go way down with more screening, testing, and contact tracing. We need to successfully limit community transmission. Second, as Dr. Tam said, at least 75% of Canadians need to have received their first shots. And we need to keep ramping up those second doses. If we can do this, then we can have a more normal, better summer. And a one-dose summer sets us up for a two-dose fall, when we'll be able to talk about going back to school, back to work, and back to more normality. That's what the coming months could look like. That's what I'm excited about. And that's up to all of us by remaining vigilant, following local public health guidelines to drive case numbers down, and getting vaccinated. Jusqu'à maintenant, on a livré près de 20 millions de doses de vaccins aux provinces et aux territoires. La semaine prochaine, comme pour chaque semaine de mai, on va recevoir 2 millions de doses du vaccin de Pfizer. Au Québec, la vaccination progresse très bien. J'aimerais remercier tous ceux qui font partie de cet incroyable effort pour garder les Québécois et les Canadiens en sécurité. Si c'est votre tour de vous faire vacciner, vous pouvez faire votre part en prenant un rendez-vous. Continuons à travailler tous ensemble pour en finir avec cette pandémie le plus rapidement possible. Partout au pays, nos efforts se poursuivent pour combattre la troisième vague. Notre gouvernement est prêt à faire tout ce qu'il faut pour soutenir les provinces et les territoires et tous les Canadiens. In the last few weeks, Nunavut has seen a spike in COVID-19 cases. As soon as numbers started going up, we moved quickly to keep people safe by sending more PPE and medical equipment. But even more help is needed, so that's what we're going to provide. We're working with the government of Nunavut and the NTI on additional and immediate support for Nunavut. This funding will help with everything from food security to communities with active cases to providing better IT equipment for students who need to do remote learning to additional health supports to protect people. Our government's priority is to keep you safe no matter where you live. And that's exactly what we're going to continue to do. Comme je l'ai dit la semaine dernière, on continue aussi d'aider les autres pays durement touchés par cette crise. Ce matin, je peux confirmer qu'un deuxième avion des Forces armées canadiennes a pris la direction de l'Inde avec des ventilateurs médicaux que nous avions en surplus pour aider à soutenir leurs hôpitaux dans la lutte contre le virus. On le sait, pour se débarrasser de la pandémie une bonne fois pour toutes, il faudrait l'enrayer partout dans le monde. La lutte contre la COVID-19 est un effort mondial. Le Canada va toujours être là pour faire sa part. Ending this pandemic is job one. But as we come into what's hopefully the final stretch of this crisis, we also have to look to building a strong recovery for every Canadian and every community. On that note, today, I want to talk about another major step we're taking to make our communities more connected, create jobs, and fight climate change. We've reached a historic agreement on public transit in the Greater Toronto and Hamilton area. If you live in the GTHA, even if you're working from home right now, I don't have to tell you what traffic's like. After a busy day at work, you want to spend time with your family, not hours commuting. Not only that, but heavy traffic also causes a lot of pollution. That's why we're working with Ontario to make improvements to public transit that people in the GTHA can count on. We're investing over $12 billion including in 4 subway projects in the GTA and 1 rapid transit project in Hamilton. To begin with, we're investing in the Ontario Line project, which will bring rapid transit from Exhibition Place through downtown to the Ontario Science Centre. Anyone in Toronto can tell you that the subway is way too busy. Sometimes in rush hour, people have to wait for 2 or 3 trains to go by before they can even get on. This major investment will not only help deal with that, but also create thousands of good jobs and get gridlock traffic off the roads. The second project for the GTA is the Eglinton Crosstown West Extension. This will create a continuous rapid transit line along Eglinton Avenue between Scarborough and Mississauga, a part of the city that needs better crosstown service. Again, this will create jobs, lighten traffic, and keep air in the GTA cleaner. The third and fourth transit projects we're investing in for the GTA are the Yonge Street North Subway Extension and the Scarborough Subway Extension. On Yonge Street North, we're extending Line 1 north to Vaughan, Markham, and Richmond Hill. If you live in the north of the city, this means cutting down your commute by almost a half an hour. For people in Scarborough who don't currently have good transit options, this investment will mean 3 more stops along Line 2. That's what this investment means for the GTA. Here's what it means for Hamilton. We're going to provide major support for rapid transit in Hamilton for a line that will go from McMaster University in the west through downtown all the way to Eastgate Centennial Park in Stoney Creek. Just like the transit projects in Toronto, this will support jobs, make people's commutes better, and cut down on pollution. This $12 billion in funding means people will get where they need to go faster, all with tens of thousands fewer cars on the road daily. In addition, part of this funding will go toward buying zero-emission streetcars for the TTC. Not only will these new streetcars help Toronto's air cleaner, this deal will also help protect good middle-class jobs at the Alstom automotive plant in Thunder Bay. Cette commande de voitures de tramway pour le transport collectif de Toronto va aussi aider à soutenir les travailleurs de l'usine d'Alstom à la Pocatière. Le Canada est un chef de file dans le domaine manufacturier du transport collectif, que ce soit pour les autobus zéro émission ou les voitures de métro ou de train léger. On va continuer d'encourager cette industrie ici au pays. Minister McKenna will share more details about these investments later today and throughout the week. The federal government always listens to Canadians, which is why we pushed hard for key conditions in the funding agreement to improve the outcomes from the projects, including community and environmental benefits, affordable housing, and more citizen engagement. But the bottom line is this. Rapid transit shortens commutes, which gives parents more time with their kids and ensures kids will inherit a cleaner future. Public transit is at the heart of a strong recovery and a growing middle class. It's also part of our plan to reach net zero by 2050. Investments like these are key to making communities more livable and affordable, communities people can love to call home. En travaillant ensemble pour améliorer la qualité de vie des Canadiens maintenant et pour l'avenir, on va rebâtir un pays plus fort et plus propre pour tout le monde. Merci. Je suis maintenant heureux de passer la parole à la docteure Tam. Teresa.
Bonjour à toutes et à tous. National trends are slowly declining, but we've still got a number of areas across the country that are experiencing ongoing resurgences. Over the past 7 days, an average of 7,275 cases have been reported daily, and the number of people experiencing severe and critical illness remains high. On average, 4,000 people with COVID-19 were being treated in our hospitals each day, including over 1,400 in intensive care units, and there were an average of 49 deaths reported daily. This week, Muslims across Canada and around the world will end their month-long fast of Ramadan with the feast of Eid al-Fitr, a spiritual celebration acknowledging the provision of strength and endurance. This year, we are all being called upon to endure a bit longer, and the reasons could not be more important: to save lives and end this pandemic. Also, this week through Sunday is National Nursing Week, when we acknowledge the unrelenting dedication, expertise, and vital role of Canada's nurses across the expanse of health and public health. We're all aware of the skilled and caring touch that nurses provide, whether it's administering vaccines to keep us well or caring for us from illness through recovery. But nurses are also working behind the scenes, contributing to the safeguarding and advancement of our health and wellness, from research and scientific studies to writing essential practice guidelines for health professionals. They have also been instrumental to the public health response to COVID-19 through contact tracing, screening at quarantine sites, and so much more. For the innumerable ways they work to keep us safe and healthy, we are grateful. And considering the ongoing and difficult period that our healthcare workforce is working through and the unrelenting pressure that this third wave is placing across the health system, there are hardly the words to thank them enough. The end of a challenge can feel like the greatest test of our endurance, but in fact, this is a powerful moment for us to show collective strength. The deepest gratitude we can show those who have helped us this far through this long and difficult crisis is to keep following their advice as vaccines continue to roll out and have more impact. For now, we need to remain cautious and do everything that we can to protect ourselves and our communities, ease the pressure on the system, and help bring an end to this pandemic. This includes making an appointment to see your friendly neighborhood nurse and rolling up your sleeve for the COVID-19 vaccine as soon as you are able. Thank you.
Bonjour à toutes et à tous. Les tendances nationales s'améliorent lentement et il reste encore un certain nombre de régions dans tout le pays qui connaissent une recrudescence des cas de COVID-19. Au cours des 7 derniers jours, en moyenne, 7 275 cas ont été signalés quotidiennement et le nombre de personnes souffrant d'une forme grave et critique de la maladie reste élevé. En moyenne, 4 000 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont plus de 1 400 dans les unités de soins intensifs. De plus, 49 décès ont été signalés en moyenne quotidiennement. Cette semaine, les musulmans du Canada et du monde entier termineront leur mois de jeûne de Ramadan par la fête de l'Aïd el-Fitr, une célébration spirituelle reconnaissant la capacité de résistance et d'endurance. Cette année, nous sommes tous appelés à tolérer la situation un peu plus longtemps et les raisons ne pourraient être plus importantes, sauver des vies et arrêter cette pandémie. Cette semaine également, et jusqu'à dimanche, c'est la Semaine nationale des soins infirmiers, au cours de laquelle nous reconnaissons le dévouement indéfectible, l'expertise et le rôle vital des infirmières et infirmiers du Canada dans tous les domaines de la santé et de la santé publique. Nous sommes tous conscients de la compétence et de l'attention des infirmières et infirmiers, qu'il s'agisse d'administrer des vaccins pour nous garder en bonne santé ou de prendre soin de nous, de la maladie au rétablissement. De plus, les infirmières et infirmiers travaillent en coulisses pour contribuer à la protection et à l'amélioration de notre santé et de notre bien-être, qu'il s'agisse de recherche et d'études scientifiques ou de la rédaction des lignes directrices essentielles destinées aux professionnels de la santé. Le personnel infirmier joue également un rôle déterminant dans l'intervention de la santé publique de lutte contre la pandémie de COVID-19 en recherchant les contacts, en effectuant les dépistages dans les lieux de quarantaine et en exécutant bien d'autres tâches encore. Nous leur sommes reconnaissants pour leurs innombrables démarches pour assurer notre sécurité et notre santé. Aussi, compte tenu de la période difficile encore que traverse notre personnel soignant de la pression incessante que cette troisième vague exerce sur le système de santé, les mots manquent pour remercier suffisamment ce personnel. La fin d'un défi peut donner l'impression d'être le plus grand test de notre endurance, mais en fait, il s'agit de moments intenses où nous pouvons recourir à notre force collective. La plus grande gratitude que nous puissions témoigner à celles et ceux qui nous ont aidés jusqu'ici au cours de cette crise longue et difficile est de continuer à suivre leurs conseils alors que nous continuons d'administrer les vaccins et que nous ressentons leurs effets bénéfiques. Pour l'instant, nous devons rester prudents et faire tout ce qui est en notre pouvoir pour nous protéger et protéger notre communauté, pour diminuer la pression sur le système et pour contribuer à arrêter cette pandémie. Cela s'entend aussi de prendre rendez-vous avec votre sympathique infirmière ou infirmier de quartier et de retrousser votre manche pour recevoir le vaccin contre la COVID-19 dès que vous le pourrez. Merci.
Thank you, Dr. New. The Prime Minister will be taking 6 questions, starting with the phone. 1 question, 1 follow-up. Doctors and Minister LeBlanc will remain available for 15 minutes afterward. Merci beaucoup, Dr. New. Le Premier ministre prendra 6 questions en commençant par le téléphone. 1 question, 1 sous-question. Le ministre LeBlanc et les docteurs demeureront disponibles pour 15 minutes par la suite. Opérateur, c'est à vous.
Merci, thank you. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de Raymond Filion de TVA. La parole est à vous.
Merci. Monsieur le Premier ministre, est-ce que vous avez des assurances à cette heure-ci que la canalisation 5 d'Enbridge ne fermera pas comme promis par la gouverneure du Michigan? Sinon, à quel point ça vous inquiète, cette possibilité?
Nous sommes très préoccupés par le potentiel d'une fermeture de la ligne 5. C'est pour ça que nous travaillons depuis des mois avec nos homologues aux États-Unis, qu'on encourage la médiation directe entre la compagnie Enbridge et l'État de Michigan. Et on va continuer de faire partie de cette discussion et d'encourager une résolution qui ne mettra pas en insécurité énergétique nos communautés des 2 bords de la frontière.
En suivi, Raymond?
Est-ce que vous avez personnellement soulevé la question auprès de Joe Biden?
Oui, c'est un enjeu dont on a discuté, la sécurité de nos échanges en énergie, des pipelines, mais nous reconnaissons que c'est un processus en médiation entre Enbridge et le gouvernement de l'État du Michigan. Nous, on va continuer de participer et de faire valoir nos préoccupations à travers l'ambassade à Washington et nos autres engagements. Nous suivons évidemment la situation de très près.
Thank you.
We continue to engage very closely in the issue of Line 5. We know that it is a matter of energy security for Canadians and for Americans. This is why we have pushed strongly for the mediation process between Enbridge and the state government in Michigan to continue. We will continue to weigh in through our embassy in Washington and with our partners, because we know that the energy cooperation and partnership between Canada and the U.S. is good for citizens on both sides of our border.
Thank you, Prime Minister. Operator, next question on the phone.
Merci, thank you. The next question is from Ryan Tilmulty of the National Post. Please go ahead.
Yeah, good morning, sir. I wanted to ask you about the AstraZeneca vaccine. There are more and more experts coming out and suggesting that it might not be a good fit for Canada's vaccine rollout, and that with our supplies of mRNA vaccines, we should back away from it. Do you still think it's going to be a significant part of our vaccine rollout?
One of the things we knew from the very beginning, Ryan, was the best approach on vaccination, particularly when we were talking about last summer when we didn't know which vaccines would land, which ones would be most effective, who would develop them, was to ensure a diversified portfolio. And that's why we have so many different types of vaccines available around the world, but also to Canadians. But every single vaccine that is delivered in Canada has been determined to be safe and effective by Health Canada. What we are encouraging Canadians to do is to get vaccinated as quickly as possible. Sign up for that first dose and take whatever vaccine is offered to you. Now, we know that we are receiving far more mRNA vaccines than we are of the AstraZeneca and Johnson & Johnson for now, but we will continue to monitor, and quite frankly, provinces will continue to make determinations about the exact details of their vaccine rollouts. From the federal government's perspective, our job is to make sure that we get the largest number of safe vaccines into Canada as quickly as possible, which we're certainly on track with close to 50 million vaccine doses that will have arrived in Canada by the end of June, and enough vaccines for everyone to be fully vaccinated by September. Nous avions reconnu que c'était très important d'avoir un portfolio diversifié en termes de vaccination et de vaccins potentiels. C'est pour ça qu'on a signé des accords et on est en train de recevoir beaucoup de différents types de vaccins. Mais je peux rassurer les Canadiens que chaque vaccin qu'on administre au Canada a été jugé sécuritaire et efficace par Santé Canada. La santé et la sécurité des Canadiens est toujours la chose la plus importante et c'est pour ça qu'on encourage les gens de se faire vacciner le plus rapidement possible pour qu'on puisse passer à travers cette pandémie. Les provinces et les territoires prennent des décisions par rapport à leur choix de vaccination et leur catégorie de vaccination. Notre responsabilité du côté du fédéral, c'est de livrer le plus de vaccins possible. C'est pour ça qu'on parle de autour de 50 millions de doses qui seront arrivées au Canada pour la fin juin et assez de doses pour que tous les Canadiens soient vaccinés complètement pour septembre.
Following up, Ryan?
Yeah, sir. I'm also wondering, you talked in your opening remarks about, a one-dose summer and the need to keep public health restrictions in place until our vaccination numbers come up. Do you think there's widespread agreement with premiers across the country? Do you expect they will keep restrictions in place until the numbers come well down in order to set up this scenario you're forecasting?
Well, I think people are eager to see what a better summer could look like. And a summer in which the vast majority of Canadians have received one dose with caseloads down across the country will allow us to gather and have barbecues with friends. We'll still have to be careful in a lot of different ways, but it will be a slightly better summer. That's why we're talking about a one-dose summer. But what we also know from previous waves is it's really important to get public health measures right and drive cases down. Vaccinations alone, one dose alone, won't allow us to have a good summer. We have to get those case numbers down. We need to crush COVID right across the country, and we need to get vaccination rates up over 75% of one dose. I know we can do that. We have enough vaccines, and Canadians have demonstrated a capacity to get those community transmission cases down. We just need to do those two things over the coming weeks so that as we get into summer, we'll be able to have a better situation.
Thank you. Operator, dernière question au téléphone.
Merci. La question suivante est de Hélène Buzetti, les coop de l'information. La parole est à vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais revenir sur cette question de la preuve vaccinale pour accéder, par exemple, à une terrasse d'un café, un restaurant ou un cinéma. J'aimerais savoir, philosophiquement, êtes-vous d'accord avec l'instauration de telles preuves vaccinales? Vous avez dit dans le passé que vous pouviez envisager des problèmes éthiques. Pouvez-vous être donner plus de détails sur quels sont les problèmes que vous envisagez? Merci.
Merci, Hélène. Évidemment, c'est une question importante, mais aussi délicate. On veut encourager le plus de gens possible à se faire vacciner parce que c'est comme ça qu'on va passer à travers cette pandémie. On a vu dans d'autres pays qu'à un certain niveau, les gens commencent à atteindre un plateau au niveau de vaccination dans la population qui est encore trop bas pour pouvoir vraiment être en sécurité. On a besoin d'avoir plus que 75% des citoyens vaccinés avec une première dose et qu'on continue avec les deuxièmes doses pour avoir un été à une dose. Pour ce faire, il y a beaucoup de gens qui regardent l'idée qu'avec une preuve de vaccination, on pourrait faire plus de choses. Certainement pour les voyages à l'international, ça va éventuellement être très important. Mais pour usage domestique, je sais que différentes provinces sont en train de regarder ça. Il y a toujours des préoccupations au niveau de l'équité. Est-ce que tout le monde a accès à la vaccination? Est-ce que tout le monde a la même capacité de se faire vacciner? Ben d'abord, les vaccins sont gratuits, sont payés par le gouvernement fédéral, donc ça enlève un certain niveau de préoccupation d'équité. Mais aussi, on voit certaines communautés ou certaines cultures sont un peu plus réticents à se faire vacciner. On veut trouver le bon équilibre. On veut encourager tout le monde, autant que possible, de se faire vacciner et d'avoir des récompenses ou plus de liberté si on se fait vacciner. Ça pourra en faire partie, mais il faut s'assurer qu'on n'est pas en train d'être injuste contre des gens déjà marginalisés ou déjà vulnérables, ou des fois il y a un peu plus de réticence. Alors, de continuer les discussions entre les différents paliers de gouvernement, regarder comment on peut faire ça de la bonne façon et de s'assurer que ce soit un positif pour encourager les gens de se faire vacciner sans aller heurter, léser ou désavantager certains groupes ou personnes. C'est la préoccupation que nous avons tous.
Et je vous entends très bien, merci. Mais sur la question philosophique, par exemple, de cette idée d'avoir, dans le fond, décliner une information médicale à propos de soi, décliner son identité à des commerçants, sur cette question-là de la vie privée, certains parlent de Big Brother, qu'est-ce que vous en pensez?
Ben, on sait que pour qu'on puisse passer à travers cette pandémie, il faut se faire vacciner. Il va falloir que la grande majorité des Canadiens se fassent vacciner. Et c'est pas juste une question de se protéger soi-même, c'est une question d'atteindre le seuil qui protège toute la société et toute la communauté. Donc, je comprends que non, on ne voudrait pas partager des informations privées sur la santé de quelqu'un, mais cette preuve de vaccination et cette information que quelqu'un ait eu le vaccin ou non, je pense que c'est parce que ça a tellement une implication pour le public, si on atteint ce seuil de 75-80%, je pense que c'est une information qu'on devrait pouvoir partager, mais en faisant attention, dans la mesure du possible, de ne pas souligner la situation médicale de gens qui ne peuvent pas se faire vacciner parce qu'ils sont compromis ou d'autres choses, de créer une façon où on n'est pas en train de trop faire pour brimer la vie privée, mais d'être vacciné, c'est un bien public, c'est quelque chose qui est important pour tout le monde. Je pense qu'on devrait pouvoir partager ça. Mais, comme j'ai dit, il y a encore des conversations et des réflexions à faire là-dessus, qui sont informées par des experts qui se penchent de différents côtés. I think it's really important to encourage Canadians to get vaccinated. We know we're not going to get through this pandemic until enough people get vaccinated. 75%, 80%, even more get first dose and second dose. So anything we can do to encourage people to get vaccinated is going to be important, and that's where the idea of proof of vaccination for different services or better access is something to look at, particularly because vaccines are free. They're paid for by the federal government. There is going to be enough vaccines for everyone in the population. We just have to reflect upon certain communities or vulnerable Canadians who might still have more difficulty accessing vaccines or might have resistance to vaccinations because of cultural or other realities that we have to be thoughtful about as we move forward. And then when it comes to the privacy aspects of proof of vaccinations aren't just about protecting the individual. They're about protecting all of society, and particularly vulnerable individuals who, for medical reasons, can't actually get vaccinated. So it matters to know that Canadians are getting vaccinated. And I think we should be able to walk the path between respecting someone's privacy, but also understanding that whether or not someone's vaccinated is something that we should be able to make use of to both encourage people to get vaccinated and keep all Canadians safe.
Thank you. We'll now take questions in the room. Tonda?
Good morning, Prime Minister. Tonda McCharles with the Toronto Star. Can I go back to what your remarks about 1-dose summer, 2-dose fall? We've had national guidance on masking. We've had national guidance on immunization. And I'd like to understand what you think, or if you even think there's a need for a national reopening plan that uses some of these markers. I mean, are you contemplating giving guidance to the provinces on case counts per 100 or whatever, like the case may be? I don't hear that kind of specificity. And already Saskatchewan is kind of ditching the 75% first dose. They're saying 70 is good enough.
I think it's really important that Canadians understand that we could have a much better summer if two things happen. If the case counts get under control across the country, if we're able to crush COVID and keep those case counts really low with adequate measures around screening and contact tracing and isolating whenever there are pop-ups or outbreaks that will happen from time to time. We need to get cases down. And we've seen from waves in the past the problems that happens if restrictions are opened too early. It just leads to a greater next wave. So the first thing we need to do to make sure we're getting into a one-dose summer where people can be a little freer and have a little bit more normal summer with friends around the barbecue is case numbers need to be down right across the country. And local public health officials will make determinations about what under control and what case counts are. It could vary a little bit, but the cases need to be down. Secondly, Canadians have to get that one dose. Canadians have to get vaccinated to over 75%. And if we have those two things, if case numbers are down and if over 75% of people get vaccinated, we can have a summer that'll be much better for everyone. And that's sort of on all of us. Different orders of government. The federal government needs to make sure, as we are, that we have enough vaccines for everyone to get one dose before the end of June, which we will, and that second dose continues to increase in terms of being delivered. That provinces keep the restrictions necessary in place until they get the new cases totally under control and are able to handle and respond to any little outbreaks that we know will happen. And third, Canadians need to get vaccinated. We have more and more vaccines coming in. We're going to be able to have enough doses so that we can have that one-dose summer, which will set us up for a two-dose fall, which will be much, much better. But everyone needs to do their part. Get the case numbers down and keep them down and get vaccinated. That's how we get through this.
Next question.
Hi, Prime Minister. Stephanie Taylor with the Canadian Press. Going back to AstraZeneca for a second, given that experts have said that mRNA vaccines are the preferred ones and there are ongoing safety concerns with the AstraZeneca shot, will Canada stop negotiating with the United States to get their doses of AstraZeneca and instead ask for, say, Moderna?
We're going to continue to talk with all our partners about ensuring that we're able to get Canadians through this as quickly as possible and as safely as possible. We will continue to work with the United States, with other countries around the world to ensure that we get enough doses to get Canadians vaccinated with one dose before the summer and that second dose through the summer so that we can have a much better fall. But on the safety concerns, I'm happy to turn to Dr. Tam to speak to that.
Thank you for the question. And I think that, as the Prime Minister said, it's really important to increase vaccine uptake because it's going to play a really important role in helping us control the pandemic and reduce the risk of resurgence. I think he provided a really important point in terms of getting the cases down at very low levels so that we can, provinces can actually test, trace, isolate, and put out these more targeted approaches so they're not going back into the fall with the more restrictive measures. That's the sort of vision going forwards. And in terms of, AstraZeneca, I think what I would say is, first of all, remind everyone that anyone who got the AstraZeneca vaccine did the right thing in protecting yourself and those you love and those around you. Of course, we have to take any reports of serious side effects, however rare, very carefully. So that's what is being done. and so that Canadians can have the appropriate information to make informed choices, and the provinces can design their programs. But what I would say is that, right now, the National Advisory Committee on Immunizations recommending 2 doses using the same vaccine. So we will make sure that those who got the AstraZeneca vaccine, the first dose, can be provided with a second dose. At the same time, we're following the evolving science, including the studies from the United Kingdom, to provide the most up-to-date advice on whether a mixed-dose schedule is the appropriate way to go. And that would offer a choice, essentially, for those who have received AstraZeneca for the first dose. And so I think the bottom line is we take any reports of serious adverse events very seriously, and that is being taken into account as we design our programs going forward.
Next question.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Je veux revenir sur la ligne 5. Si la médiation échoue entre Enbridge et le Michigan, le Canada va-t-il invoquer le traité de 1977 entre le Canada et les États-Unis qui limite les actions unilatérales lorsqu'il est question de transport de ressources, de pipeline? Est-ce que vous allez l'utiliser, cette option-là?
Nous reconnaissons à quel point on est interdépendant, interconnecté avec les États-Unis en matière d'énergie. Et c'est pourquoi nous sommes en train de travailler de façon extrêmement étroite avec les Américains sur cet enjeu. Je sais que le ministre des Ressources naturelles, le ministre Regan, va avoir une annonce qu'il va faire très bientôt pour parler de notre positionnement là-dessus et nos préoccupations avec la situation. Nous allons toujours faire ce qui est nécessaire pour protéger les intérêts des Canadiens, pour défendre la sécurité énergétique des Canadiens. On va avoir plus à dire dans quelques heures. I can assure you that we are watching very, very carefully the situation with Line 5, as we have for many, many months. We've continued to engage on it, and Minister of Natural Resources, Seamus O'Regan, will be out shortly with an announcement on further engagement by the federal government to ensure that we're defending Canadian interests and Canadian security.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly told Canadians not to travel abroad. Earlier this month, your foreign minister was in the UK. He's headed back to Iceland later this month, even before his 14-day quarantine period is up. You've talked about the possibility you're going to go to the UK for the G7. What do you say to Canadians who have put off travel, maybe to go to funerals or to see family around the world, when they see that's a mixed message, that people in Canada are traveling, but they're not allowed to?
We continue to highlight the need for essential travel. There are thousands of trucks with food and essential goods across the U.S. border every day. We continue to see essential travel happening. The question always remains, what is essential travel, and are the rules going to be followed? We had to make sure that we kept Canadians safe when we shut down the borders to non-essential travel. For non-Canadians over a year ago now. And Canadians and people around the world have responded. We have seen a drop in over 95% in travel volumes over this past year, and that has kept Canadians safe. But there are moments where essential travel is necessary, and those decisions will be made. But at the same time, all proper safety protocols will be followed. All quarantines and testings will be abided by because nobody is exempt from keeping Canadians safe.
For you and Minister LeBlanc, possibly, the Justice Minister in Alberta made some comments last few days about how the provincial NDP and the media and the federal Liberals wanted to see Alberta's provincial health system collapse during the pandemic. Wondering what your response is to that and whether it colors your relationship with Alberta as you try and work through the pandemic.
I think it's a shame to see people pointing fingers and laying blame and suggesting that anyone in Canada wants anything else than to get through this pandemic as safely as possible everywhere. Last week, I reached out directly to the Premier of Alberta, to the mayors of Calgary and Edmonton to continue to offer all the help that the federal government could possibly offer to help Albertans and indeed all Canadians get through this. Every step of the way, the federal government has been there to support Canadians, with 8 out of every $10 in pandemic support coming from the federal government. We will continue to work with Canadians. We will continue to work with all governments across this country to make sure we're getting through this. That's what Canadians want to see. That's what the federal government wants to see. That's what opposition parties want to see. And that certainly is what the media is focused on as well. I think playing politics at this point is just not what Canadians want to see. Je pense que c'est très clair qu'il n'y a personne dans ce pays qui veut autre chose que de passer à travers cette pandémie avec le moins de tragédie possible. Partout au pays. En tant que gouvernement, nous avions toujours été là pour toutes les provinces et territoires. La semaine passée, j'ai parlé au premier ministre de l'Alberta, j'ai parlé au maire des deux plus grandes villes, Calgary et Edmonton, pour répéter une énième fois que le gouvernement fédéral est toujours là pour aider avec quoi que ce soit qui est nécessaire. On a aidé les citoyens, on a aidé les travailleurs avec 8 $ sur 10 de tout argent qui a été là pour aider les gens à travers cette pandémie venant du gouvernement fédéral, et on va continuer de l'être. Je pense que c'est désolant de voir des gens essayer de jouer de la petite politique là-dessus, parce qu'il n'y a pas personne qui veut autre chose que qu'on passe à travers en sécurité, que ce soit les gouvernements, que ce soit les partis d'opposition ou que ce soit les médias. Nous allons tous continuer de travailler ensemble, parce que c'est ça ce dont les Canadiens ont besoin, et c'est ça qu'ils veulent voir.
One last question.
Salima Shif, GCBC. I want to ask you about what's happening in the Middle East. So Canada's policy on Israel and Palestine is predicated on the existence of the Oslo peace process. A lot of experts say that process has been dead for years and doesn't reflect the reality on the ground. The reality on the ground is renewed tensions. So with that in mind, what do you say to what we are seeing in Jerusalem as well as in Gaza? The exchange of rockets and airstrikes in which 9 children are among the casualties.
The violence and deaths we've seen in Israel right now and in the region are terrible. There needs to be de-escalation immediately. We need to see a cessation of violence and attacks. The rocket attacks from Hamas are absolutely unacceptable. But we're also gravely concerned about the settlements and the evictions of Palestinians. We need to see a return to conversations and dialogue and de-escalation, an end to the violence, including the violence at the Al-Aqsa Mosque, which are just heart-wrenching. We need to see a path towards a two-state solution through negotiated conversations. Any unilateral, unhelpful actions on either sides are not contributing to the kind of future we all need to see.
Merci, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui. On va maintenant continuer la conférence de presse avec le téléphone opérateur. Operator.
Thank you, merci. And yes, the next question is from Brian Mullen of Global News. Please go ahead. Oh, actually, and we have lost him. Et la question suivante est de Catherine Lévesque, la presse canadienne. La parole est à vous.
Oui, bonjour, merci beaucoup. J'ai une question peut-être soit pour les docteurs, soit pour M. Leblanc. Je veux juste revenir là, sur cette première dose cet été, ces 2 doses à l'automne. Je me demandais, est-ce que le gouvernement maintient toujours en fait la date limite là, de septembre, dans le fond, que les Canadiens seront pleinement vaccinés en septembre? Je me demandais si on pouvait avoir plus de précision peut-être sur l'échéancier là, quand tous les Canadiens auront reçu leurs 2 doses. Merci.
Ben, moi, je peux peut-être offrir quelques commentaires et ensuite le Dr. New ou le Dr. Tam pourront ajouter. Madame Anand et le Premier ministre ont toujours été clairs que nous aurons, avant la fin juin, 48 à 50 millions de doses de vaccins approuvées comme étant sécuritaire et efficace au Canada, et ça va permettre à tous les Canadiens qui désireront avoir un vaccin d'avoir au moins la première dose avant la fin juin. Et au courant de l'été, nous allons recevoir suffisamment de doses que tous les Canadiens qui désireront être pleinement vaccinés, ça veut dire évidemment les 2 doses, tout cela pourra se faire avant la fin septembre. Évidemment, si les provinces sont capables administrer les programmes de vaccins et les Canadiens s'inscrivent dans la mesure du possible, il est peut-être probable qu'au début de septembre, on souhaite que tous les Canadiens seront pleinement vaccinés, mais nous avons la certitude d'avoir les vaccins pour que tout cela soit en place avant la fin septembre.
Merci. C'est Dr. New. Il n'y a pas beaucoup plus à ajouter à ce que le ministre Leblanc a déjà constaté. On continue à travailler étroitement avec nos homologues des provinces et territoires. C'est sûr, avec l'horaire, l'approvisionnement, la livraison des vaccins ici au Canada, c'est un peu de plus stable, et aussi on attend avec impatience des autres doses qui arrivent au pays. Donc, c'est vraiment une question pour les provinces et territoires, parce qu'ils continuent avec leur planification, avec les vaccins qui arrivent dans leur juridiction, pour planifier à offrir les vaccins à tous les citoyens dans leur province et territoire. Donc, je pense que pour nous autres, si on parle de la perspective de la santé publique, c'est une chose d'offrir le vaccin, les vaccins, mais c'est aussi quelque chose à suivre, comme dire, l'acceptation des vaccins, parce qu'on sait, ici au Canada, avec les sondages, c'est vraiment encourageant que la plupart des Canadiens, je pense que le dernier sondage, j'ai vu plus que 80% de la population indiquer qu'ils veulent recevoir le vaccin. Donc, c'est quelque chose à suivre, mais pour nous autres, c'est aussi quelque chose très important comme cible, vraiment les vaccins administrés, pas seulement les vaccins livrés aux provinces et territoires. Mais pour moi, pour les autres, c'est vraiment des bonnes nouvelles. On attend vraiment, on espère une meilleure été que l'été passé. Merci.
En suivi, Catherine?
Oui, c'est un autre sujet, Monsieur Leblanc. Je voulais revenir sur C-19. Comment est-ce que vous justifiez un bâillon, en fait, sur ce projet de loi sur des élections en pleine pandémie? Doit-on en comprendre qu'on se dirige vers ce scénario-là, possiblement à l'automne, justement?
Non, pas du tout. Nous avons toujours dit depuis des mois et des mois que nous ne cherchons pas à provoquer une élection. Nous cherchons à rester et à demeurer focusés sur l'aide nécessaire pour aider les Canadiens à passer à travers la pandémie. Cependant, le directeur général des élections, au mois d'octobre, a demandé au Parlement de regarder certaines mesures temporaires qui s'appliqueront éventuellement si il y a une élection dans le contexte d'une pandémie. Je dois vous rappeler qu'il y a eu plusieurs provinces qui ont fait des élections dans le temps de la pandémie. Alors, le directeur général des élections, qui a le mandat légal de s'assurer qu'Élections Canada soit prêt à tout moment pour des élections partielles et pour une élection générale, c'est d'autant plus prudent dans un Parlement minoritaire. Il a demandé au Parlement de considérer des mesures temporaires pour donner plus d'outils à Élections Canada afin de protéger non seulement ceux et celles qui vont aller voter, mais les 250 000 personnes qui travaillent à administrer les élections dans tous les coins du pays. Alors, nous pensons que les conservateurs ont évidemment aucune intention de laisser le débat conclure. Ils veulent à tout prix prolonger le débat sur tous les projets de loi. Et nous croyons aussi que le Parlement doit demeurer focusé, par exemple, sur les mesures budgétaires qui vont aider directement les Canadiens et les provinces à passer à travers la pandémie. Alors, c'est pourquoi nous avons jugé bon de laisser le comité de la procédure de la Chambre regarder le projet de loi, apporter des améliorations ou des amendements que le comité jugera importants. Et ensuite, le processus parlementaire se fera. Mais en même temps, le Bloc québécois vote toujours non confiance dans le gouvernement. Alors, c'est un peu hypocrite de prétendre qu'ils ne veulent pas une élection à tout prix, ils veulent éviter une élection. Nous, au gouvernement, on ne vote pas non-confiance dans notre gouvernement, mais le Bloc et les conservateurs, souvent, presque tout le temps, votent pour des élections. Alors, nous pensons que c'est prudent pour le comité de regarder ce projet de loi-là.
Thank you. Operator, we'll take one last question on the phone.
Merci, thank you. The next question is from Eureka Walsh of the Globe and Mail. Please go ahead. Your line is open.
Good afternoon. My question, I think, is for Minister LeBlanc. I'm wondering if you can just explain a bit more what the government's approach is right now on purchasing AstraZeneca. Can you confirm if the government is still trying to, as was repeated last week, push for earlier and more deliveries of AstraZeneca right now?
So our government has, from the very beginning, once Health Canada approved vaccines as being safe and effective for Canadians, obviously we've done everything possible to get as many of those vaccine doses into Canada as quickly as possible. We are happy that Canadians were impatient to receive the vaccines, that provinces have done a great job in preparing vaccine rollout plans. So we continue to work with all of our suppliers with whom we have contracts to bring as many doses of vaccines that are safe and approved for Canadians to Canada as quickly as possible. With respect to AstraZeneca, we expect 665,000 additional doses of AstraZeneca to arrive in the coming weeks. And there's also another 1 million doses we have under contract with the company that we expect to arrive in Canada in the month of June. So our policy of accelerating as many doses as possible, as quickly as possible, and be able to deliver them to provinces and territories, our priority has not changed.
Following up, Marika?
Thank you. Yeah. So can you explain to Canadians, as we see provinces reconsidering the use of AstraZeneca, and Alberta being the first one to say it won't book first shot appointments for AstraZeneca, why are you still pushing for more AstraZeneca at this time?
Well, because as the Prime Minister stated a few minutes ago, the best way to ensure that all Canadians who want to get vaccinated can get vaccinated as quickly as possible is to have a diverse supply of vaccines from different parts of the world. 7 different companies have signed agreements with our government. So we'll continue to pursue that very basic strategy of having a diversified portfolio of vaccines with hundreds of millions of doses under contract to come to Canada. I'll also note that my colleague, the Minister of Procurement, discussed arrangements that have been made for vaccines in 2022, 23, potential booster shots. So that work is ongoing and will continue. But we have a contract to receive AstraZeneca vaccines, and provincial health authorities will decide the way that they, in their judgment, see those vaccines best administered to their populations. But it would be irresponsible for Canada not to pursue the 665,000 doses of AstraZeneca that we expect to get in the coming weeks, and the 1 million additional doses that we'll get in the month of June. And those vaccines will be distributed to provincial authorities to be administered to the populations that they decide in their best judgment should receive those vaccines.
Thank you, Minister LeBlanc. We'll now finish in the room.
Good morning, Tonda McCharles, Toronto Star. I think this question is for Dr. Tam. Dr. Tam, I wonder if you can tell me, is it the view of the Public Health Agency of Canada that a national reopening plan that provides national guidance on reopening benchmarks is not needed, and that the government ought to defer to the provinces on all the benchmarks in terms of reopening?
Thank you for the question. And at the Special Advisory Committee with the other Chief Medical Officers of Health, it's pretty clear, I think, the kind of indicators that are needed to be tracked in order to do safe reopening. And as you can imagine, those indicators helps us track that we've got the third wave, for example, under control in terms of cases, the rates, the reproduction numbers, the hospital capacity, the public health capacity to test, trace, and isolate. Those are not new. They are indicators that we all think are important to track as people are looking at reopening, and do it slowly and gradually, because if not, and a resurgence can happen, especially the vaccine coverage isn't high at the moment. So I think, as the Prime Minister said, those kind of indicators are important, and every province, of course, have a very different context, and they need to take into account and track all of those parameters as they move along. I hope slowly, deliberately, and carefully, because this is, I hope, our final challenge. If we can keep on suppressing the cases and get the vaccines up, we will have a year that looks considerably better moving ahead. But that's both important. I think the other message is really not to just rely on the vaccine uptake number. Those cases have to come down as the vaccine doses are going up. But the vaccine indicator is important to track. It gives us an idea of the population protection, immunity, and some of those indicators and those numbers come from modeling, as you probably know, and a lot of parameters are thrown in, but a 75% target for that first dose, moving as fast as possible to the 2-dose, is an important indicator to track alongside the epidemiologic ones.
And so I take from that then that your view is not to advise the government that it needs a national reopening plan. And if I'm wrong in that understanding, please correct me. And I just, my I guess follow-up is the whole musings about the first dose, second dose, and whether or not, I know you're waiting for the UK study, but whether or not it can be a mixed dose schedule. Have you contemplated that maybe the advice is a stick to the same dose? And if you have, what are you projecting for the national vaccine rollout, given the difficulties in sourcing AstraZeneca for those who've got already a first dose of AstraZeneca? Does that make sense?
Yes, so we know that overall, to date, roughly, I think, 2 million people would have got the first dose AstraZeneca. And as I said, they made the right decision for themselves and also for those around them. And the amount of vaccines coming in that Minister LeBlanc has described is expected to essentially provide a second dose using the same vaccine for those who already received a first dose for AstraZeneca. And I think we can commit to those vaccine recipients that second dose will be there for them because that's the current advice. But I think it is important to follow the clinical trial data and be able to offer a option for those who've already received that first dose. And we're looking forward, hopefully, to see that data in a number of weeks. And I think the United Kingdom officials have provided some context of when that might be possible. And I think the key being that before this first group of people who receive AstraZeneca vaccine is due for that second dose, we'll be able to provide that advice to them.
Next question.
Hi, Dr. Tam. Stephanie Taylor with the Canadian Press. There's a growing call from some provinces, or for some provinces, to relent on the public health restrictions on outdoor activities to allow more people to do things outside. Given that the risk of transmission is low, should and can provinces start to look at relaxing restrictions specifically outdoors before perhaps achieving that 70 or 70% benchmark yourself and other local chief medical health officers are working with?
I think, again, this is just one key benchmark, and I think it's very important for people to have a target to shoot for. At the same time as it is the decision on very localized public health measures must be done with the data that they have locally. They have to be able to suppress those cases because otherwise I think it's very difficult to ensure that cases are tracked, where they got the infection from. Having said that, the outdoors is definitely safer than the 3 C's, closed, crowded, close contact environments when you're spending a lot of time together. Those are the last ones that could probably be going back to normal. But outdoors, so as the Prime Minister said, towards a summer where you can have more activity outdoors, particularly with those that you in your household or small groups, and be able to do some of those activities very important, as well as, of course, physical activity and mental health. So I think the outdoors should be the first stage or included in that first stage of having people do more. As to exactly the level of vaccination target, we're giving a benchmark, but I do know that the provinces have more complex calculations on the epidemiology, including for example, how much immunity there exists in their particular population. Provinces that have encountered a lot of COVID activity might have more people already infected. And so they've taken some of those kind of calculations as they are looking at their vaccine targets. But I think it is important for, everyone in Canada to have something to keep their eye on so that we know that there is a path forwards that is much more positive and hopeful.
Thank you. We'll take one last question in the room.
This is a question probably for Dr. Tam and Dr. New. We're seeing provinces like Alberta decide to delay, to no longer give AstraZeneca as a first dose and save them for the second dose just because of supply demands. I wonder if that, do you think that's an effective strategy that all provinces should be doing at this point in time?
I think provinces are in the best position to look at how to best use all the vaccines they have available to them. What I do know is that there's not that much left of the existing AstraZeneca supply. So some provinces are thinking that, okay, well, we might know that 655,000 is coming in soon, and then, we're expecting more. But that they feel that as a prudent measure, that they would keep the small amount that they have left in order to ensure that second dose for those who already have it. And that would be up to them in terms of planning purposes. It is difficult for people when, they as the schedules are being firmed up, they can feel more, confident about how they plan those vaccine rollouts. But I think it is different between jurisdictions because some actually doesn't have any AstraZeneca left and are waiting for the expected the next 2 deliveries.
Merci beaucoup. C'est ce qui m'a fait la conférence de presse d'aujourd'hui.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.